Okay, so in this video we're going to look at a blister in the hindfoot now, which is probably the second most common area patients and runners get these. What we're going to talk about is a blister here. I've drawn one on the lateral side of the hindfoot here on the outside of the heel, but this dressing system would equally apply to those on the heel properly or on the medial side if their shoes rub. I've got to say, in my experience, it's uncommon to have on the heel pad here, that fatty pad that lies under your calcaneum, the heel bone there. And that's really because that area is designed to shear, is designed to be wet, is designed to take force. The heel pad exists here on the hindfoot, and you can see it moving here, to absorb that shear force as you move through the gait cycle. So it is uncommon, but not impossible. Ill-fitting footwear, poor socks, foreign material or sticks or something within the shoe can cause blisters. And obviously as footwear gets destroyed over the course of a race, you can get blisters in some weird places. First thing to say really is when you're doing this, you might lift the patient's shorts or leggings just a little bit, just to make sure there's nothing going on up here that you need to worry about. Occasionally there might be a cut or a wound up here that's dropped some foreign material down into the shoe causing this blister, and it's worth just double checking. It would be a shame to miss something there that would put someone out of a race just because you couldn't be bothered to look. So anyway, here we are. We've got the patient, we've got them comfortable on their side here. So first thing to do really is the same as for any other blister. Clean the area up, a little stirret, which is included in the checkpoint bags, or a wet tissue, or improvised hand gel or something, just to clean the area up. Alcohol will dry the skin, make the dressings more likely to stick, and will also do a nod in the direction of antisepsis. And again, the standard rule for blisters apply. If you can run your hand over the blister and you can't feel a change to the contour of the skin, don't do anything with it, just dress it. If, as you run your hand over the blister, you feel it raised, you can feel the bubble of the blister, you're going to need to clean it. 2, 3 or 4 small holes in the bottom of the blister express the fluid, don't de-roof it. Leave the skin on. Whether we like it or not, and whatever you might do at home, the presence of the skin over the top of the blister is an extra layer of protection and reduces the chance of infection. And remember, infection is our enemy with all wounds in all climbs on adventure races. So, we've achieved that. We've got a nice smooth blister, we've cleaned the area, the patient's comfortable. Next step, fleecy web. Now, we don't have any fleecy web today. All the fleecy web we have is actually out on events right now, so we're just making do with some elastoplast tape, which is the same sort of colour. Your fleecy web will come in strips between 5 and 7.5 centimetres wide, between 30 centimetres and 3 metres long, depending on what's been arranged for your particular trip. Take your piece of fleecy web that's the approximate size of the blister. Corners are our enemy when it comes to dressings that are going to sit in shoes. Corners tend to catch, roll up and act like a little pebble within the shoe and go on and cause problems. And of course, if the runner wants to remove them, the dressing's got to come off. So the first thing to do is to round the corners of your fleecy web off. Fleecy web comes in a strip, as I say. It's between 2 and 3 millimeters thick, depending on exactly who manufactured it and how it's been stored. It has a sticky back to it with white paper that you have to remove to stick down, and works to take the shearing forces away from the skin. But it is this sort of colour. It's cleaned and we just apply it down. 2 things to do: make sure you press around the edges and make sure you warm it with your hand for a minute or so. What that does is warm the glue on the back of the fleecy web and just helps it to stick to the runner's skin. Remember, their feet are likely to be hot, and so that will aid it sticking down, but that's an important step. The fleecy web there, nice and stuck to the skin. If a runner has creases in the skin in this area, just because of the shape of their foot, just gently flatten those out. The fleecy web should stick to all the skin and not be trapping folds of skin underneath it. If it does, that's just a route for infection to get in, the dressing won't stick properly, it will work its way off, and it will be uncomfortable for the runner. So we've applied our fleecy web. Remember that blisters are caused by a triad of heat, damp and friction. In an adventure race, we can't get rid of the heat. The runner's feet are going to get hot regardless of the environment. Even in the ice ultras or races such as the spine race where it's very cold, their feet will get hot. Can't deal with that. We can't necessarily deal with the wet. The runner's feet are going to get wet. They will go through puddles, they will go through rivers, and certainly by the end of the first day their feet are unlikely to be properly dry again. What we can do is do everything we can to eliminate the friction as the limb of the triangle that we can get rid of to control for blisters. So we've applied our fleecy web, and that's our primary effort to get rid of the friction. But fleecy web alone is not enough. It's a very good dressing, it does a good job, but it's not enough to resist the forces that are going to go through it when a patient is running. So the next step is the tape, and the tape is critical because it will hold that dressing on, it will provide longevity to that dressing, robustness to it, but needs to allow the patient's foot and ankle to move normally so they can compete properly. Now with a blister in the hindfoot, you've got a couple of things to think about. Number one, the ankle obviously goes up and down, and it needs to do that for a runner's gait to function normally, otherwise you're going to run into other problems. But more complicated than that, the hindfoot goes in and out, and that's important because that helps you walk over and run over uneven turf and territory. If you were to restrict that at all, you're effectively removing mobility from the foot, and that will cause problems if left long enough. So when we're taping, we need to be mindful of that. This tape here is effectively a kind of kinesio tape that we use. Over the years, experience has shown that it's the most successful tape. It resists the friction movements the best. It's certainly very sticky, and it is very elastic, as you'll see when it's applied. And what that means is it allows for movement of the foot, it allows for swelling of the foot as the race goes on, or in the heat. It allows everything to contract down at the end of the day without losing its adhesion. And patients generally like it. It's easy to apply, it's easy to take off and replace if needs be. So we've dressed our blister here, and remember, as I say, this would apply for a blister on the inside of the foot, on the sole of the foot, or on the back. If you have one over the Achilles, same idea, but remember, you mustn't have a fold of skin. Just stretch the Achilles, apply your dressing, and let it sit where it wants to. If you're going to strap the Achilles, just remember the impact you're going to have on the biomechanics of the Achilles. This is effectively like using an elastic band to reinforce the structures over which it's applied. If you apply a piece of tape like so over the Achilles tendon, it's going to reinforce the action of the Achilles tendon. So ever so slightly, going to pull the foot down into plantar flexion. Just remember that when you're doing it, tape it in neutral. Don't tape it stretched, don't tape it loose, tape it in neutral. Enough of an aside. So what we're going to do now is apply the tape. Now you might imagine that taping in this area is slightly awkward. Every runner's foot is slightly different. What we're going to do here, and remember tape loves sticking to itself, so just take hold of it as you do it, is we're going to let the tape meet in the front of the foot. The reason we're going to do that is that's where the pressure from the footwear is least, and much as patients want to dorsiflex their foot, it never wrinkles very much. So we're going to put the foot into neutral. We're just going to stretch the tape around gently. As you can see, I'm not pulling that tightly, and bring it around the front of the foot to meet itself. Now this piece of tape is slightly too long. That problem is easily solved with my tough cuts. And remember, tape springs and loves to stick to itself. It always curls. Stick it down straight away. Good. So we've done step one of the taping. Now, let's address what you can see at the back here, the crinkles. Now, two ways of tackling this. What I tend to do, where you see the angle forming, and what you can see there is it's starting to bunch up, just give it a prune, like so. And because the heel is a robust area, you're safe to overlap. So overlap your tape, make a cut, overlap. Same applies on the front of the heel, on the plantar surface of the foot, make a cut, overlap. Don't worry about the fact that there's lumps there for a moment, we'll get to that. And you follow that around the foot where you see a fold. If the tape's already stuck to itself, prune that fold off. Just lift your foot up, just support it with your arm if you can. Where you see it, prune it off, make it flat. Where you've got an option, take it and fold it. If the corner keeps coming up, then it has to go. So that corner keeps coming up, it has to go, and so on. Okay, now we're doing this for demonstration, so it's not perfect, but you get the idea. Your two options are fold it over or snip the fold that forms. Let me show you what I mean by a fold that forms. Here's a piece of tape, imagine it going around a bend. What will happen is it will do that as you go around a bend. It will make a big fold there that will stick out from the foot. Okay, All you do with that, and this is much magnified, take your scissors, cut it off, make it flat to the foot. If we look at the front of the foot now, what you can see are some corners. And corners are the enemy, as I say. Very simply, lift those corners and cut them off like so. To make the tape stick completely, warm it again. Warming it will warm the glue up and make it stick to itself. Tape will only robustly stick to itself. It will not stick just to the skin. So it's no good doing a small arch that doesn't meet. Now let's say you've done that, but for whatever reason, part of your blister is exposed down here. You've got one on the plantar surface of the foot and it's still exposed. What you would need to do in that instance is a second layer of tape. Let me show you what I mean. If I cut a length of tape off, free it from its backing paper, remember that tape will always bunch up, so try and take it both ends as you do it. What we're going to do now is just apply between a 30 and 50% overlap with the tape adjacent to it. And remember, you will have bumps and lumps that come off. Don't do it too tightly. Just let the tape, if you maximize the stretch on the tape, there's no stretch to give as the foot swells or splays as the patient runs. Okay, what we're doing now, we're splitting and we're overlapping. If that doesn't work, we're folding and we're cutting the fold off so it's flat to the skin. Hopefully that all makes sense to you. Again, on the front of the foot, check it's stuck down, check for corners, peel it off. Or cut it off rather. Now, all done. Blister in this case is under here. We've dressed it. I appreciate it's a bit flapping. The tape's not very sticky today, and this particular runner hasn't cleaned their feet. But you get the idea. Those are our techniques. Last thing to do, make sure the ankle moves freely. Can you move it through a normal range of movement without seeing pulling on the skin or excessive stretching of the tape? Does it invert or evert, and does the forefoot pro and supinate? Ask the runner, is that comfortable? Can you move your ankle normally? Are you happy with that? If the tape starts to peel off before you've even finished, you've got to do it again. Either the foot wasn't dry, was still sweating, or your tape was wet, or there was something wrong with it, but you've got to do it again. Remember that corners are the enemy. Remember that tape does stick slightly better to very clean, dry skin. And remember that you're going to have socks over the top of this. Try not to let your tape extend to finish at the same place the top of the socks are. The seam of the sock plus the tape is just a little bit too bulky for that piece of skin, and you're likely to run into problems. Equally, down here on the heel is very prone to problems. You can see here, I've done a fold and there's a little pip of tape there where there's a fold at the base of the split I've made to get around this curve. You must check that, and if it's there, you must cut it off. Very simple. I'm doing this with my left hand, so it's not working very well. You must snip that off. Let's swap hands so you can see properly. You must cut that off so that it's flat under there. If you can't do it, if it's not going well, ask for help or do it again. Very, very straightforward. Tape in general, 30 to 50% overlap. Do as much or as little as you need to, but please bear in mind what that foot and ankle is going to be doing the following day on the next stage, or the rest of the stage if you're at a checkpoint. It's going to be working hard, it's going to be moving, it's going to be swelling. You must take that into account with your taping. I hope that's useful with regards hindfoot blisters. Midfoot blisters are uncommon, but they do happen particularly along the lateral edge, and really it's a combination of this taping and the forefoot taping that we covered in an earlier video that you'll use to really address those. The thing with the midfoot is really the hind and forefoot move around it, so you're safe to really do circumferential taping. Remember that blisters on the inside of the foot, A, they're uncommon, and B, that isn't a weight bearing area, so you're all right there in most cases to do a very simple dressing. Again, if you've got any questions, just email me on brett@exilemedics.com. There'll be more and more blister care and foot care videos going online to help you in preparation for your Exile Medics event, but I hope you found that useful. You'll certainly get lots of practice on our events, and there's always an old hand around to help you. But as I say, any questions, do let us know.